Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here is your host, hospice and palliative care leader and educator, Dr. Millicent Burke Sinclair.
Hello and welcome to the Quality of Life podcast. I'm here today with Dr. John Bryant, Vice President of Operations and Support Services at Pardee Hospital. Thank you so much for joining us, John.
It is my absolute pleasure. Always wonderful to have a conversation and sit down with you, so thanks for the invitation.
Well, I'm really looking forward to what we're going to be able to share with our community today. In fact, you have such a passion for the community and helping people access the care they need. Could you share a little bit about what's led you to this passion?
Absolutely. I think there are so many things that draw you to service in the community in which you live. And, I've been fortunate enough to experience it in a lot of different ways. When you think about contributing to not just the health of the community, and certainly with the mission statement at the hospital to improve the health of the communities that you serve, you're always asking yourself, what are you individually doing, collectively doing? What is the organization doing for that? And, having an entire career in public education, which has been all about taking care of not just the children of our community, but the future of the community. Yeah, healthcare in many ways is a twin sister to that. It is immensely connected. My parents were involved as healthcare administrators. Many folks in this community know that my mother served as a chief nursing officer. My father was a chaplain in the hospital. Yeah, and so I've always felt that connectivity to it. And then, having been a recipient of that care, my family, my wife's care through her cancer journey, you get to see it in real time. And so service, I think, with our county hospital, service with UNC Health Pardee, and ultimately, giving back in that way. A passion is about feeling like you're leaving it better for someone or providing someone what they need when they need it. And so that's pretty special.
I love what you said because it connects us to Four Seasons mission moment of co-creating the care experience. And I always like to say co-creating the best care experience because that's the truth.
Very much so.
We want every moment to be the best for those we're honored to serve. And when we think about it, people come to us somewhat for different reasons oftentimes, and perhaps you engage with them initially. But they come to us at a time where this is a changing season for their life. It's something that they could oftentimes be thinking, I might not get better, or my loved one might not get better, but they still need help. They still need hope. They still need a hand.
Right.
And so when I think about help and hope and hand, that's a lot to do with community and serving the community. And so, with hospice and palliative care, which is our primary focus, we have care navigation and grief support and home care and the like, but we work really well in the community, and we're grateful for the collaboration that we're able to have with you.
Oh, it's incredible. As you said, I think, when you talk about that hope and that hand, it's about being hand in hand. And, I think that is what you all live so beautifully. When I think about the way in which we serve the community together and that we do it so beautifully, it's that we are hand in hand, arm in arm, leading that journey for individuals so deliberately and so purposefully. And maybe, it's something that connects so much to what we see in the work that your team does, but it's being present for people as they're experiencing a period in their life that oftentimes they don't necessarily have an answer for or for a script for. And there's a desire to feel like you have the support that's needed. And, I think that's what's done beautifully when you think about our work together.
Well, and similarly, as you talked about that, regardless of the reason someone may come to you, they have a need. And it could be scary. Some parts of it could be known. Some parts could be scary.
Certainly.
For us, it's normally always pretty scary.
Right.
And so having a partner like yourself and your organization, it means the world to us, because if we are going to co-create, we co-create within our team, but we need partners and collaborators who are out in the community saying, hey, we want to provide the best care also. And certainly you do that.
Most definitely.
So that makes me think about a question. When a patient needs hospice and palliative care inside of a hospital, some people are confused about why the care is needed while the person's already being cared for by hospital staff. How do hospice and palliative care not only help the patient, but result in great collaboration. And we touched briefly on it,
We
but could
did.
you expand a little?
Absolutely. I think what's powerful about that question is sometimes, and you probably do a lot of this with your team, is really help people understand what palliative care is, what hospice care is, and thinking it. We'll speak to palliative first. You talk about relief from a condition or a state that you're already in, but you're also talking about care navigation. You're talking about someone and an entire organization that also helps lead you through that work, maybe helps you to avoid needing hospital care, maybe in a preventative standpoint, or helps guide you through that process, or better understand the things that you can do to live your best life during that period of time. And so I think the best answer to that is, a partnership with Four Seasons, especially through the hospital, is about a continuum of care. It's not the moment necessarily that you're receiving direct hospital-based care, but oftentimes it's understanding what kind of things can be done before you need care in an acute care setting, or most importantly, afterwards. That collaboration with our care management team, our hospitalists, our direct care providers, helping even someone make sure that they understand how to navigate, the behaviors for them that are going to keep them feeling the best they can feel in that period of time, I think is critically important. Hospice often is one maybe folks are more familiar with. When you start thinking about, okay, we've made the decision that curative care isn't necessarily the direction at that point. And so now you are supporting an individual, you're supporting their family, you're supporting a journey. And having someone who does that in such a trusted way is critically important, not only in a healthcare setting, but for those individuals as they move through that healthcare setting. And so one of the most important things we can do is to have a network of support that is fully trusted, that is fully aligned, that has, as we've talked about already, a similar connectivity to what we're giving back. And so we see that, in really, really poignant ways and powerful ways. And one of the things that we hear, and to your question, is that a lot of times people in our community, especially our patients, don't know the difference. That what they feel is the support from start all the way through finish, versus seeing it as, oh, now I'm working with a different organization, or I'm working with a different team. They in fact feel like they're working with just a continuation of the same team. And that's when we've really gotten it right.
Well, and that's what makes me think of the continuum of care.
Right.
And so having collaborators, partners, individuals, and organizations throughout the community that say, hey, we want to be an ambassador for care. We want to be an ambassador for help. We want to be an ambassador for our community. And so I love how you started out by saying, your career started in education, but education actually is really similar to healthcare. Same as me.
That's right.
Yeah.
That's right. So, I know we've had that conversation in the past. That's
it's really a beautiful opportunity to say, how can I help? And that makes me think of another question. So as you know, but some of our listeners may or may not know, we serve 14 counties across Western North Carolina.
The region.
Yes. And what a gift to be able to say, hey, no matter what you're feeling, we can help. And certainly you and the hospital can do the same within the spaces that you serve. And when we say, no matter what you're facing, we can help, that means either we can provide care or we can connect you with those who can.
Exactly. And that, if there was a message that you almost kind of say, what is the takeaway in that moment? It's that let us be part of how we directly provide care or connect you to that. And it that's the reassurance that oftentimes we don't think about what we need until we need it. And then when we're faced with that decision for a loved one or a family member, or even for ourselves, to know, oh, I can reach out to Four Seasons and they can either help me think about how I'm going to navigate this, or they're going to provide that direct connection. They can reach out to the hospital and know that, oh, we have these tremendous partnerships that are going to help navigate that. It makes all the difference in the world to know that that's where you reach out, that's the purpose, is to be part of connecting you to what you need.
Yeah. And you had shared early on, but there's so many needs within a community. When you think about all the needs that exist, it's pretty powerful to be able to say, we have confidence that your organization, my organization, other like-minded organizations are here to provide high-quality care.
Right.
That we genuinely care about each individual living in our community. Again, whether we are the appropriate one to serve or whether we can connect with one who is. So often we hear, I just don't know what to do. I need help. I don't know where to start. I'm exhausted. I'm scared. All these feelings. And what I love and what's important to us is when we have other like-minded organizations like yourself that say, you know what, we want to be a part of saying yes to, we can help you, whether it's direct or indirect.
Right.
Yes, we can help you because we can connect you if we're not the ones to provide that hands-on care. But there's a really special service that Pardee and Four Seasons are able to offer together. And so I want to ask you a question specifically about that. Could you talk a little bit about the palliative care services that are available in hospital settings? And now certainly these could exist in many hospitals, but particularly with your hospital, I'd love for you to just share with listeners, what does that look like?
Yeah, and it goes back a little bit to what we talked about at the beginning, but it's understanding, what is it that we're trying to provide? And so there are a number of individual conditions or diagnoses for which patients and their families are seeking the highest quality of life, the highest quality of understanding as they navigate what is their new normal or what is their new part of it. And that palliative care says, hey, we are going to partner to help you understand how you, again, work through a complex health system, how you best understand the direct support that is necessary in your personal care plan, because for every individual, it's going to be different. Sometimes we talk about a health condition as if everyone experiences that same way. And I would say understanding palliative care programs within the hospital and our partnership is understanding that every one of those care plans is individualized. Oh, that's so important. It is. And to be able to answer those unique questions from an individual or from a family that says, okay, I need to have direct touch points with my care management. I need to have direct touch points with my providers. I need to figure out, and as I said, what will keep me out of the hospital? What will help me to make sure that I'm doing the kinds of things that are going to provide me, again, the best quality of life, the best care, but also that I can be proactive in some of those decisions. And some of that does come back to thinking about how we, again, not only communicate with the individual, but how we communicate with the support system that is around that individual. I've heard your team talk about it a lot, but so much of I know what you guys do well, when you think about those 14 counties in the region, is you're supporting entire support systems for individuals. And that palliative care piece is really important about that, saying like, I'm seeking relief from this. This is what is, my story, my journey right now. How can I best take care of myself, take care of my family, and understand what that journey is going to look like? And that's really what that is. And so, we're really proud of that work. We're really proud to be able to see that take place for individuals. But I think the most important thing is to really emphasize that those care conversations are patient-based. They are individually centered. And then they're an opportunity to sort of say, as that evolves, as that journey continues, that you have a touch point for understanding how you navigate all of that.
I think you said something so important about individualized care. Absolutely. I think that we can go to certain places in our everyday life and possibly sometimes not feel like something that we are experiencing is individualized. But with healthcare, particularly the care that you provide, the care that we provide, we want to make sure that listeners understand it is individualized. And actually, one of the reasons why our mission statement is co-creating the care experience is because it's co-creating the care experience that's most important to you and to your loved ones. And so, I might need different things than you need, right? And so for our listeners, if you're like, well, but my loved one has this unique need or this unique modification, that's okay. We care. And let us know.
Right, and help us to understand that. And you've hit something that maybe is the greatest touch point for all of us, are when the patient story and the family story from that level of care, especially when you have all of that interface with the individual, that when it really sounds like this, they say, I just felt like you got to understand what my needs were. Did you understand what my worries were, my anxieties, or ultimately gave me that reassurance in the space where I most needed it? It's because it is so individualized. It is not a printout of a care plan. It is not just, the details on the schedule for your medication. It's really being present and engaged with you and being able to say that what you need right now might be very different than what you need in a month. Yes. It may be different than that is okay, but it's okay to acknowledge that at each stage of any person's individual care, and when we think about the work that we do together, that we recognize that that's an evolution of a relationship, and that's what's most important to us.
Throughout our community, there are hospital providers like yourself that say, we are here for the community. We want to meet the needs of the community. And so could you talk a little bit about some programs that Pardee offers specifically that helps the community age in place?
So when you think about those specific programs that help people age in place, what we recognize is we have a community that has unique needs associated with what their preventative care strategies might be, what their opportunities might be to receive direct care, and then ultimately when you start thinking about very specific needs for the individual that we talk about, that you understand how to receive those direct services. And so you think specifically about our cardiology programs, you think about our physical therapy, inpatient and outpatient, you think about our primary care provider through BlueMD, and that care that can be from licensed social work counseling to pharmacy consultation to behavioral health support services to just a general understanding of direct care plans that are going to allow you to be, again, your healthiest, best self moving forward, that it is intentional that we're thinking about, okay, what are the needs of that individual, and how do we know that those needs are going to exist? One of my favorite things to do is to visit our physical therapy sites and look at all the things that are helping individuals not only to age where they are, but to be able to be the most mobile, to be the most active, to feel like that they are really making sure that their bodies are the healthiest version of what.
Yeah, to live well.
Absolutely.
Yeah.
And so much of living well is feeling like you can be out in the world, that you
is.
can connect with the people that you want to continue to connect with. And so those are really key elements of that. But I think it's also, as I said, recognizing, our mission is to take care of the citizens of our community and to know that when you desire that level of care, that you can reach out to that. My favorite conversations to be a part of or to be witness to are when individuals are talking to a primary care provider and they're talking with their doctor about what they want to be able to do, what they expect to be able to do as they move forward in their life. And then to recognize that there's all kinds of opportunities to further support that when we have an understanding of what those needs are.
One thing that you said, I think that I want our listeners to be aware of is an understanding. So often within our life, we may not understand something. We may not understand why we feel a certain way, what's going on with us, how to get the help we need, where are the resources. But they could just call you.
Absolutely.
They could just call us. And that's a huge benefit within the communities that we serve, that, I want our listeners to know you don't have to suffer alone, wonder alone, or fear alone. We want you to have confidence that within the communities that you live in, we have listeners that listen from all throughout our counties.
Right.
And so we want them to know, call your hospital, call us. And it just so happens in this space, they can call you.
What we know to be true is people want access to care closest to where they live, and they want to make sure that care, as you said, is the highest quality it can be. And what we really emphasize is we also want those partnerships to be with the same excellence and that level of care that we expect of ourselves. And, that's what we're so proud of with Four Seasons, because we think about that. We think about the expansion of our footprint in order to serve people where they are. In order to be present in their communities for the needs that they have. And then to really expand upon that by saying, okay, no, you have this really robust healthcare network of specialty providers for acute level needs or specialty needs, so that when I need to see an orthopedic surgeon, you have that touch point. When you need to see a cardiologist, you have that touch point. When you need to see an oncologist, that you have that touch point. I mean, the story I have most frequently told, and everybody in my world hears it all the time, but there was nothing more comforting upon my wife's diagnosis with breast cancer 10 years ago now than knowing we had a world-class cancer center 7 minutes from our house. Literally here on our campus, that was the level of care that she was going to be provided in our community, and it makes all the difference in the world.
You said something really important that I want our listeners to hear is access to care.
Yes.
Where you live. And I'm going to add, by people who live there.
Yes.
By
people who are in that community, invested in that community.
Yes. They live it, they know it, they are part of it, and they care about it.
Very much so. That they are integrated into
Yes,
that community.
yes.
They're not present because that's where the office is.
Right.
They are your neighbors.
That's it. They live
That's
there.
exactly right. They are your friends. They are your loved ones. They are the
Right.
people that you end up seeing in the grocery store and at church on Sunday and all the
Yes.
things, because they are a part of the community you live in, and they're part of the care that is given to the community that you live in.
I think that is so, so important. And so if I was a listener and I said, I don't know where to start, but I know I have this serious diagnosis, call. We can help you.
Yes.
And what I love that you were giving examples of, whether someone has a serious illness, like needing palliative or hospice, or whether someone is needing a hip replacement, they can call.
Yes.
To you. They can call their primary care provider. They can call. And oftentimes we hear, I don't have a primary care provider. And so we want to encourage.
We can help you with
yes,
that.
we want to encourage listeners.
That's right.
There are tremendous primary care providers all throughout the counties that we serve, and you happen to have a lot of them.
That's right.
Within yours.
That's right.
So.
Exactly. We've got over 55 primary care providers who are employed with Pardee, who are providing that service across the region, and we continue to expand that footprint. That number is going to double in the next 12 to 24 months. And so what's really important about that is it's exactly what you said. It's you don't have to solve that part of the puzzle. We'll solve that part for you. I love being able to tell people quite simply, when folks are like, I might need to see, a sports medicine doc or an orthopedic surgeon, or like we said, or I want to understand, again, a care plan for my physical therapy. I'm like, don't you worry. It's one number.
That's it.
You call Pardee's, orthopedics and sports medicine, and that direct service, we're going to connect all the dots for you. We're going to make sure that you have that care
What
plan.
a gift.
And it's just like what you see, as you said, that if it comes down to palliative care conversations or hospice care conversations, your team, our team, are going to work hand in hand together to serve that individual and their family.
Well, when we think about serving individuals throughout the community, you talk about how Pardee is a part of the community. Four Seasons, likewise, a part of the communities we serve, founded in 1979 in Henderson County.
Henderson County,
yes,
that's right.
Right here. Now, we serve many counties beyond, and so we make sure when we go into a county that we hire people from that county, that we learn about that county. As a nonprofit, currently, from the beginning, always till forever, that's important that our community knows we are committed to the best care. We are a nonprofit. We are local to the communities that we serve. We hire people who are local. We get volunteers to be a part. Why? Because it matters that we're a part of the community.
Most definitely. And that has always resonated with me as we've been engaged in events, supporting that shared service to the community, talking to the individuals that are part of that, seeing those faces that say, they are uniquely local in that respect. And it says we want to be part of a value add to that.
Yes.
We want to be partners in that work, but we also want to be present in that work that says we're about making this a healthier, happier, safer, more hopeful community collectively together. And, when you talk about improving the health of the communities you serve, you have to be thinking about all of those functions.
What you said could almost be one of the most paramount parts of this conversation to me, because it's wherever you are, we can help.
Most definitely. And want to. Yes.
Exactly.
That's the passion you asked about at the beginning, is that we are urgently waiting to serve you.
Yes.
And wanting to do it in such a way that says our ability to truly live our mission respectively, interorganizationally, is to be engaged with people who need us and to be present for them throughout that need.
Thank you so much for sharing that. When you were talking about programs, I want our listeners to know we're not just talking about people within a certain age demographic.
Oh, not at all.
You serve patients that have just been born.
Oh, yes.
Right?
Absolutely.
Or not even born yet.
Not even born yet.
Right.
That's right.
Same for us.
The readiness for it.
Exactly. And so when we think about Four Seasons provides pediatric care to patients and their loved ones from the very beginning, if it's needed, and grief services when that's appropriate, if it becomes necessary as well. And so one of the things that I think is so important for our community to know is that we are trusted and we want to earn your trust. And so if you're at a place in your life where you say, I just don't know what to do, but I know I need help, and I know I'm facing some type of health matter that's concerning, just call. We want to bring you peace. We don't want you to stress. There are so many things that people could stress about. But health care is one of the things that I'm so grateful to get to be a part of, saying, hey, let us lighten your burden a little bit by providing that trusted care.
Absolutely. And to know that phone is going to be answered.
Yes.
That individual is going to be seeking the opportunity to serve you
Yes.
and thinking about how we can help you navigate, again, uncertainty, the challenge of not knowing what to do next, but also just to recognize that sometimes it's just as simple as reassurance that says, hey, I'm here. We've got you, and we're going to do that for you and with you and by your side.
Well, thank you so much for being with us today. We appreciate you. We appreciate the collaboration with Pardee Hospital. Thank you so much for joining us
My
today.
absolute pleasure. Thank you, Millicent.
And to our listeners, if you would like to know more about Four Seasons, please go to our website. If you'd like to know more about Pardee, just go to the website.
PardeeHospital.org. That's correct.
It. Just go to your browser and type it in. We're grateful so much for your time.
Thanks so very much.
Thank you.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.